Okay, so Dr. Jade here. We're going to do a quick 8-minute case. Jade, who are you?
So I'm a patient called Thomas Smith.
Thomas Smith, yeah.
I'll be 62.
62, yeah.
I've got a history of high blood pressure, so
Okay.
hypertension diagnosed 6
Okay.
months ago.
Yeah.
Started on medication, 5 milligrams of amlodipine.
Okay, so hypertension, 5 milligrams of amlodipine. You said 6 months ago, right?
Yeah.
Been on it since then?
Yeah.
Okay. Any other PMH?
No, let's say.
Okay.
That's the only one.
Anything else on my notes? Not really. I just say it's quite bland.
Yeah, so came in a week ago, routine blood pressure check, had been sent for, so
Okay.
nurse checked blood pressure,
Yeah.
bit raised, so asked to see a doctor.
Okay. So Thomas Smith, 62, hypertension for 6 months, on amlodipine, came a week ago for like a routine health check, something like that. BP was noted to be high. Let's say what? 100, what are we saying?
170?
170 by 90.
Okay.
Yeah, say that 170 by 90, and you were asked by the nurse to come and have a chat with me, and that's why you're here today.
Okay.
Good. That doesn't sound like a good setup. Should we get 8 minutes on the clock?
Okay, let's start the timer. So we'll start that.
Okay, let's go. Hi, is it Mr. Thomas Smith?
Yes.
Hi, I'm Dr. Aman, one of the junior doctors in the practice today. How are you doing?
I'm fine, thank you, doctor.
Good. What's brought you to see us?
Oh, the nurse checked my blood pressure last week and said it was up a bit, so I should come and see you.
Okay, so this is blood pressure related, and yeah, I did actually see on the notes that you came last week, and your blood pressure was 172/90, and yes, asked to see the doctor. So first, I'm glad you come. Thank you for coming. I think blood pressure is an important thing to talk about. When it's raised, we do pay attention to it and try and see what's going on. So I want to ask you a couple of questions about things like your blood pressure itself, symptoms that you might not or might be having, a bit about your thoughts about what's going on, lifestyle things that can impact blood pressure. Does that sound reasonable?
Yeah, sure.
And we'll see what we can do on the other side.
Okay.
So let's talk about blood pressure itself then. You've obviously had it for about 6 months, so you'll be aware of some of the questions I'm going to be asking you. You've probably had them before. There are a couple of yes-no kind of medical questions that we'd like to ask just to make sure you're not getting any symptoms of blood pressure. They're quite rare, but I'd like to run through them if it's okay.
Sure.
Yeah. So, for example, we ask about things like chest pain. Anything like that happened in the past?
No.
Okay, shortness of breath?
No.
Any palpitations or racing of the heart?
No.
Good. Nothing unusual like any swelling of the ankles?
No, they've been
Good.
fine.
No pain in the legs at all?
No.
Good. And some things we often ask about are things like vision changes?
No, it's just the same.
Good. Headaches?
No.
Dizziness?
No.
Fantastic. So it sounds like you're generally doing okay, not got
Yeah.
any symptoms that you know of yourself.
No.
Fine. Often people with blood pressure problems don't have any symptoms, but important to check. So that's really good news. There are a couple of lifestyle things that can impact blood pressure. So I can ask you a couple of things about your lifestyle, if that's okay.
Yeah, sure.
Certainly things like habits, smoking can impact blood pressure. Do you do any of that?
No,
Ever
don't
smoked?
smoke. When I was a teenager,
Okay,
smoked some time ago.
many years ago. Alcohol can impact blood pressure.
No, not really.
Okay. Diet certainly can impact blood pressure. How's your diet?
Probably not the best.
Okay.
I do like my fast food.
Okay, so takeaways,
Yeah.
tasty.
Pizzas.
Yeah. So generally there's a lot of salt in that type of food actually, and that can be really important when it comes to blood pressure. So how are the salt levels would you say in your diet generally?
I do like salt. I tend to add salt to any meal I have. Does it taste nicer?
It does taste nice, I agree with you, but that's actually really important. That can have a big impact on blood pressure. So let's bear that in mind, and we'll come back to that. Exercise levels can impact blood pressure. Do you do any?
Yeah. I go to gym and I walk to work every day.
Okay, so
Walk
daily
the dog.
exercise roughly, would you say? Okay, that's good.
Yeah.
Good. And how long a day are you doing roughly?
30 minutes probably walk there.
Sounds good. Sounds good. How's your weight?
So yeah, it's always been okay.
Okay, you're not going up.
No,
significantly.
just the same.
No going down either.
No.
Good. We'll check your weight a little bit later on because that can play a part as well. Certainly things like stress levels can play a part. How's work? Do you work? What is work?
Yeah, we're working in an office. It's going fine actually.
Okay, so it's not particularly stressful, but it sounds like you're sitting down most of the day.
Yeah.
Okay. And what about home? Any stresses at home? Who is at home?
No, I live on my own. How I like it. So
Friends, family around?
Yeah.
Mood okay?
Yeah.
Good. Thank you. That's very useful to know. Let's talk a bit about high blood pressure then. So a lot of people have different thoughts about high blood pressure. What goes through your mind when we talk about hypertension or high blood pressure?
I know it's really common, isn't it? It's just something lots of people have.
Yeah, I agree. It's actually one of the commonest things that we see. An important thing, but a common thing. So we can talk a bit about what it is and why it's so important going forward. Did you have any particular worries at the moment? I know you were asked to see us by somebody else, but any particular thing on your mind?
Not really. No, I feel fine. So yeah.
That's good. Often people do have concerns, but it's good that you seem nice and content with life. What about anything that you thought we could do for you today? I know you didn't choose to come here, but now that you're here, was there anything that you thought we could do today?
Not really. I mean, I feel fine. I don't know if we need to do anything really.
Okay, fine, reasonable. So let's have a look at you, but before I do that, a few questions about the medication. I can see you're taking a medication called amlodipine at 5 milligrams.
Yep.
Is that something you're taking regularly?
Yeah,
Good.
just as I'm told, yeah.
Not missed any doses?
No.
Excellent. And no side effects that you noticed from that medication?
No.
Good. Important to take it because not taking it can lead to problems. Great. Thank you very much. Lots of questions there, I know. I'd like to examine you if that's okay.
Sure.
What I'd be firstly looking to do is get a repeat blood pressure to see if it's still as high as it was a week or so ago. I'd like to check your weight, calculate what we call a BMI. I'd like to do a few other numbers, check your heart rate, check your oxygen level, check your breathing rate. And also I'd like to have a listen to your heart, listen to your lungs, and have a quick look at your ankles to check for things like swelling.
Okay.
That'd be okay?
Yeah, that's fine.
Great. So thank you, Mr. Smith, for letting me examine you. Just to quickly run through what we found, so your blood pressure was actually a little bit raised, similar to what it was a week ago.
Okay.
I got it as 176/92.
Okay.
So it's hovering around that level. Your heart sounded good, lungs sounded fine, the other numbers sounded okay as well, felt okay or were okay. Your BMI was 26, which is kind of on the higher end of normal, but nothing to write home about. So all in all, it was fairly okay, except for that blood pressure being a little bit high. So what we're dealing with here is what we call poorly controlled hypertension.
Right.
You know what hypertension is. The reason we talk about poorly controlled is that ideally we're looking for a number to be around 140/90 or less. So twice now we've measured yours and it's been a little bit raised, and that's a little bit higher than we want or ideally would like. Do you want me to explain that a bit more, or hypertension in a bit more detail, or are you happy with?
I'm happy with that. They went through it before.
Good. So there are a couple of things here that actually we need to have a bit of a chat about. Firstly, we do need to bring that blood pressure down.
Yeah.
Now you're taking your medications, you've been on this dose for a while now. We're probably looking at the stage of increasing the dose to try and get that blood pressure down. I'll talk about what the dose is and side effects and things going forward, but that's something that we do need to think about doing.
Okay.
But also you mentioned diet, particularly eating quite a little bit of salt, and that can really push up blood pressure as well. So we're kind of fighting it if we're increasing the dose, but also increasing the salt levels.
Okay.
So we need to have a bit of a chat about diet, and in particular salt. I
Okay.
think that can make a big difference. Now, because your blood pressure is raised twice now, and because it's about 170 plus level, I think I'd like to start off with the medication first,
Okay.
because I think it's important that we start to bring that blood pressure down. Now, we do have guidelines in the UK as to how to approach blood pressure that's not well controlled. You're taking 5 milligrams of amlodipine, and you're not getting any problems or side effects, which is great. I would like to increase that to 10 milligrams once a day, if that's okay with you.
Okay, yeah.
How does that sound?
That's fine. So just double up.
Double up, yeah. The guidelines, we tend to have two options with blood pressure. Either we add another medication, or we increase the dose of the medication that you're already taking. Now, because you're taking medication that's not causing you any problems, because we have some leeway to go with the dose, that's why I choose this option first.
Okay.
The guidelines will suggest that as well. If we're not winning at that point, we may be at a stage where we need to add a second medication, but that's a little bit far in the distance at this point. You didn't have any side effects with amlodipine, but now we're increasing the dose. It's worth going through a few common ones again.
Okay.
People tend to talk about swelling of the ankles, which is why I was asking that earlier. That's something to look out for. Sometimes people can get headaches as well.
Okay.
And there are a few other symptoms I'd like to go through before you leave to look out for that indicate maybe it's not suiting you so well.
Okay.
At this point, did you have any questions?
No, that's fine.
Okay, I'd like to get you back probably within 2 to 3 weeks to recheck your blood pressure again to see if we've started to bring it down. But in the meantime, I'd like to talk a bit about diet as well.
Okay.
Now, salt is really, really important when it comes to blood pressure. Were you aware of that? Has anyone explained that before?
I think they mentioned it at the beginning, but I do like it, so I just kind of...
So do I. It's tasty. I mean, is there anything that you think we could do to try and get that level down a little bit? What do you think?
I suppose I could stop adding salt to my meals. That's probably already got it in.
Let's maybe aim for that.
Yeah.
If you're struggling, we do have things like dietitian support that we could get you in touch with. We have leaflets available as well that we can offer you. But how does that sound as a general starting point? We'll look at